And then I'm just going to do the briefest possible introduction and save the time for the members of the community to have the
We are now live, and I will start the process to broadcast on Facebook immediately.
So we're ready?
Yes. Attendees are filtering in right now.
Okay. Well, good morning. My name is Steve Miller. I'm a volunteer with the Disability Vote California Initiative, which is a collaboration of more than 40 nonprofit organizations throughout the state and hundreds of individuals. We're all working hard to give every single person connected to the disability community in California the information they need in order to make their vote count. We're very appreciative of Assemblywoman Christy Smith's ability to make some time available for a short conversation this morning with members of her community. The only thing I want to make sure that we all know is this is a nonpartisan collaborative effort, and we have made equal access and equal invitations to both candidates. At this point, we have had an acceptance from the other candidate for this office, but that is always open to him. And with that, I'd like to turn this conversation over to 4 members of the local community who will introduce themselves, and then we'll start our conversation by asking the Assemblywoman to introduce herself. Matthew, would you like to introduce yourself?
Yes, my name is Matthew Berrey. I currently am 21 years old who has special needs.
Great.
And I'm Matthew's mom. My name is Victoria Berrey, and I also work for a local agency that assists families who have a family member with a disability called the Family Focused Resource Center. And we serve the San Fernando Valley, Santa Clarita Valley, and Antelope Valley.
And my name is Carly Fulgham. I'm the president of Autism Society Ventura County. We've been active for about 26 years now, providing programs and resources for our community. And our sister affiliate in LA has been around for over 50 years, active on the ground. Good to see you.
And I'm Ruth Janka. I'm a longtime resident of the Santa Clarita Valley, and I'm also the executive director of the North Los Angeles County Regional Center. We coordinate services and supports and provide advocacy assistance to roughly about 28,000 children and adults in the Antelope, Santa Clarita, and San Fernando Valleys who have developmental disabilities, which include autism, intellectual disabilities, cerebral palsy, and severe seizure disorders. Oh, and also wanted to share nearly 25% of the individuals who have developmental disabilities also have co-occurring mental health disabilities in our community. Nice to see you.
Matthew, do you want to ask the Assemblywoman to introduce herself?
Ask Christy to introduce herself.
Hi, Christy. I'm Matthew Berrey, and
Will you introduce yourself?
And will you introduce yourself?
Thank you, Matthew, for the introduction. I'm so happy to. My name is Christy Smith, and I'm a candidate for Congress in California's 25th district, which includes the communities of Simi Valley, Porter Ranch, the Santa Clarita Valley, and a very large portion of the Antelope Valley. And I've been proudly serving this community for 11 years now, first 9 years as the school board member in the Newhall School District, and for the last 2 years as the representative for the 38th Assembly District in the California State Legislature in the Assembly. It has been an honor and a privilege to have a wonderful working relationship with the disability activist community. You all are some of the most passionate, dedicated, strong advocates that our state has on any single issue. And we know there is still a great deal of work to be done, both at the federal level and of course at the state level, when it comes to adequate funding for the programming that is necessary and required to make sure that our disability community lives a full and robust life and has equal access and equal opportunities to all of the privileges like education, transportation, jobs, and employment that everyone else enjoys. So I am very proud to be here today to have this conversation, and I look forward to answering your questions.
Great.
Matthew, you want to ask your next question?
next year I will be all done with high school and I would like to go to college or get a job. I would like to ask you, if you are elected, how will you help people with special needs go to college so they can get good jobs when they finish college?
That is a really great question, Matthew. And I'm very excited for you that you're taking that next big step really soon. And I think a good choice, because I went there and I would love to see you give it a go, would be to go to our local community college, College of the Canyons. But whatever path you choose, if you didn't choose College of the Canyons and you chose maybe a job training program or a four-year university that's available to you locally, what I want to be sure of is, first of all, that you would have all the financial aid and financial support that you need. We know that college and job training can be one of the most expensive things that a family has to provide for. And so ensuring that those opportunities are there for you is incredibly important. Also understanding that there would be additional supports in place that you might need access to on campus, whether that is a personal assistant to help you around campus, someone depending on an individual's disability, whether they would need someone to help them in class with note taking or with any kind of translation services. That's incredibly important. And then also making sure that some of the health and mental health supports that you might need are available to you on college campus during your day. And for anyone who might have the additional challenge of physical limitations, that they are on a campus that is barrier-free for them, that they are able to make their way around the campus to get to their classes, to be seated comfortably and to participate like anyone else. Or if accommodations are needed, that they could be accommodated so that their content could be provided in a way that they would be able to then use and best benefit from. So I know that we still have a lot of ways to go in eliminating some of those barriers. But I am looking forward to seeing all the great things that you accomplish, Matthew, and I'm very excited.
Thanks.
Great. Christy, hi, nice to see you.
Hi, Victoria.
I have a question. You know, as Matthew's mom, I'm really grateful for all the people that have come before us who kind of paved the way through all these great laws, the IDEA, regional center system, and then the federal programs that we rely on, all the opportunities for our kids to grow up with the same opportunities as everybody else, to go to school, to go to college, to get jobs. I'm thinking also of Social Security, of Medicaid with all the community opportunities that are funded through Medicaid. And of course, healthcare, which is really important both to me and to Matthew. He also has a chronic health condition. And we rely on these programs to be around even after parents are no longer around. But we're also aware that all of these programs each year are on the chopping block or are potentially on the chopping block to cut their funding, or sometimes there are threats to eliminate them altogether. And I'd like to ask, what would you be able to do in Congress to help shore up these programs?
Oh, thank you, Victoria. I really appreciate the question. And that's really where the need lies. And historically, and I wish that in every election cycle, we at least had this as a piece of the conversation. But historically, IDEA has been woefully underfunded, given the mandates and the necessary supports that are built into the legislation and the program. What we end up investing in terms of federal dollars is pennies on the dollar compared to what the cost of the delivery of those supports really is. And we need to have a conversation about that. And we need to make this a really important budget priority and an investment, because it impacts our ability to deliver those services at every level, from preschool all the way through an individual's college or job training experience. Without the funding in place, we do the best that we can with the resources that are available, but there's so much more that could and should be done to support these really important programs. Another aspect that I don't often get to talk about, but my husband is in the financial services sector, and he has a number of clients that he works with where there is a child in the family with challenges, and planning for their future in an environment where the family will not be there to provide those critical supports anymore, and what that looks like, and the significant responsibility that those families feel. And those with resources can do some amount of planning that provides for financial security and longevity beyond the family being available. But for many, they solely rely on Social Security and Medicaid in order to be kept whole in those circumstances. And so what is concerning to me, again, is that we don't include the disability community and the disability rights community in these very important conversations about Medicaid and about Social Security. When you talk about eliminating or reducing the payroll tax that supports these important programs, the unintended consequence, although I happen to believe in this case, it is the intended consequence, is that it diminishes the future viability of those programs, putting them at risk. But when we talk about the fact that it is the disability community who are some of the greatest success stories in making sure that those who need it most are provided for under Medicaid and under Social Security, it means we're not having a complete conversation. Of course, we want to protect our seniors. Of course, with Medicaid, we want to protect those who can't afford healthcare coverage otherwise. But it really is the individuals in our disability community who need this, who need it long-term and lifelong for sustainability. So we need to have that as part of every conversation that we have around those two critical programs. Same with the Affordable Care Act. That allowed us to get to the place that we are where pre-existing conditions are protected. Everyone in the disabilities community has a pre-existing condition that requires them to have that very important coverage in place in their healthcare programs. We cannot afford as a country to go backwards there, and we cannot take those protections off the table for those in the disability community. So you can count on me in Washington, D.C., as I have attempted to, in these same conversations that we've had in California, to be a voice and an advocate, and to make sure that these families and these individuals' stories are brought to the table, and that becomes a part of the conversation, because far too often it's not.
Thank you, Christy.
Thanks. And actually, to kind of go along those lines, one thing that I see is month over month, year over year, the Department of Labor statistics show that within 1 or 2 percentage points, the unemployment rate for people with disabilities is always twice that of the rest of the population. And estimates for people like me on the autism spectrum that want to work are that 60 to 80% are unemployed or underemployed. So I once met a taxi driver who had 3 PhDs, but he couldn't get past the interview process.
Right.
So there's a great amount of evidence that with just modest accommodations, the majority of people with disabilities can become successfully and productively employed. Studies show that companies are 28% more profitable when they include disabled people equally in their workforce. So I think a key to increasing employment opportunities is employer partnership, their willingness to make those modest accommodations and to get past the stigma. And the federal government, through all of its operations, department services, and private sector vendors, is one of the largest employers in California. And so wouldn't it be marvelous if they made a commitment to be one of the leading employers of disabilities in the state? I mean, what do you think you would be able to do to help with that?
Well, I love this question, because I think it's again, part of it is about raising that awareness, right? And talking about the fact that with very modest accommodations, typically that the adjustment is huge, and more people can be gainfully employed in the system. Another fascinating thing, which I think is new in the emerging science around particularly autism spectrum disorders, is that there is real connectivity between those on the autism spectrum and what their unique talents are, and how those can be deployed in certain sectors, particularly in the tech sector, in analytics, in banking. I saw a fascinating story on this just recently. And so we need to be investing more in those research avenues to help figure out what does that matching look like with the talents and the skill sets, and then translate that into meaningful job training programs, and then the necessary workplace supports, which can also be incentivized through either tax credit programs or through direct grants to employers to make those accommodations possible. So really there's a lot more we can be doing in the research arena. We need to be tying that in a meaningful way to those investments that allow the accommodations. And then we don't have the argument that it's a double-edged sword. Look, folks are willing to work. And again, to your point, with a very little bit of accommodation, that's entirely possible. And then they're able to become a productive part of the system, which then also helps to support them. So it's a win-win all around. But again, a conversation we need to be having, an investment we need to be making.
Thank you.
All right, so good morning. So you've expressed your agreement, your acknowledgement with the federal government's role in the disability community. And particularly, of course, in the lives of the individuals that we serve. Washington's 3,000 miles away, and we're concerned about decisions that will be made that impact our system or our services and supports here at home. And so if we send you to Washington, how will you remain in touch with this community?
I appreciate that question. You know, the same as we always have. I have enjoyed such a great relationship, not only with the regional center, but all of the local advocacy groups across this district. You'll have my phone number. You will have an open door to my office. You will be a welcome part of the robust conversation that we need to have as members of our community when we're talking about policies that improve the lives of everyone here in the 25th. And while I'm making those decisions far away, my heart and my commitment will be here at home with all of you whose families I know and have embraced, and look forward to doing this really important work. But you know, you opened this question with the federal government's role in supporting the disabilities community. And there sometimes this is where the squabbles happen about the, you know, big government versus small government. But ultimately, the role of the federal government in many of the programs that it supports like this are about providing a level playing field where on a state-by-state basis, states may not have the resources to do that themselves. And so there is a very critical role for the government at the federal level to continue to play in supporting these programs and being part of this advocacy, but again, fully funding the critical supports that have been built in and the anticipation, the expectations of the accommodations we will make for our disabilities community. We need to get closer to fully funding IDEA.
Thank you.
Well, I have a follow-up question, if you don't mind. You've expressed support for all of the critical issues, our kitchen table issues. We get that quite often from people who are in elective office. Clearly, we're a good cause. People want to express their appreciation and their support for the disability community. More often than not, when the hard negotiations and deal making take place, either in Sacramento and more so in Washington, we find our issues part of what gets dealt away for the grand bargain.
Right.
If this community helps send you to Washington, how will you be a strong voice to make sure that our needs are not dealt away when the large grand bargains are made?
Well, I have earned the nickname from my husband of Mighty Mouse, and it is typically because on issues that I am very committed on, I am determined to use what is sometimes my small voice, but my large elbows to continue to advocate for something that is so important to me and that I believe in. And I have had such, again, the great privilege of having these relationships across this community that has given me not necessarily a unique perspective, but a context that I think is often left out of the conversation, right? When there is this kind of aggregate, the disability community, we're not talking about the significance of the individual stories and what this means in people's day-to-day lives and what those real struggles are like. And then it becomes very easy to sweep that under the rug. And so I would be privileged to be able to invite folks from our local community to participate in these conversations, to be there to testify as needed, to write firsthand personal narratives on the importance and the significance of why, to your very valid point, these are issues that cannot be swept up in the grand bargain because the stakes are simply too high. And it is one more piece of the puzzle where nationally, if we are looking to address income inequality, the huge gap that continues to happen in income inequality and in defeating poverty and homelessness in this country, the disabilities community is one part of that we cannot afford to take off the table because that plays such a big role. So I will do my level best, but I will count on you to come and be a part of that conversation with me to have bigger than just my voice.
I have another follow-up question. Will you meet with representatives from our community on a regular basis to hear about our issues, particularly as they pertain to pending federal legislation or proposals?
Absolutely. Yeah, you can count on me to have a complete open door policy. And no matter how busy I am, this will be a priority. If it is something urgent and we can't immediately get you connected with me, you will absolutely be connected with someone with my staff, and I will get to the meeting as quickly as I can. But I haven't turned down an opportunity to meet yet. I don't plan on it in the future. And the regular check-ins are important because, as we all know, it is equal parts budget priorities, the big legislation, but sometimes simply agency regulatory changes that change and impact the way that you all are able to do your work. And so we need to be ever mindful. Those will have to be regular and ongoing conversations in order for me to be kept abreast about how you are being impacted by decisions that are being made.
Thank you.
Ed, do we have any questions from the audience? Okay,
Oh, there is one in the Q&A.
Yes, there is one in the Q&A. I'm terribly sorry. I was trying to speak, but I had muted myself. We do have a question from Wesley Witherspoon. What do you plan to do about COVID-19 if elected?
Thank you. First and foremost, this becomes, I think, the biggest priority for both, hopefully the new White House as well as the legislature. We need to be investing right away in a national public health protocol that allows us to get infection levels back under control. I am incredibly worried about what is happening now with the increased caseload across the country. So first and foremost, dealing with that through a couple of key things. Finally, establishing a contact tracing program in the United States that works and that states can implement and rely on. Making sure that we have robust and adequate supplies of PPE, whether that means ramping up national production and deploying the National Defense Act in order to get that done. That's something we need to do right away. Investing in states. So right now it is critically important that the legislature pass and that this president sign a new stimulus investment prior to the end of this year. I would hate to see us have to try to wait till the beginning of next year. But first and foremost, we need to stand America back up by getting it healthy again, as we wait for a vaccine to be available and for more therapeutics to be available that help people recover fully from COVID-19. And then we work on, at the same time, recovering our economy. So again, having stimulus resources available, connecting people who find themselves in the situation where they're unemployed to continue to get unemployment benefits. And then, as we know, unfortunately, so many people, their healthcare benefits are tied to their employment. And so making sure, California has been very intentional about keeping Covered California open and allowing people to enroll in healthcare on the open exchange. But that doesn't happen in every state. And so we need to be very mindful that people will probably need help making sure that they have got healthcare coverage and making sure that nobody goes bankrupt as a result of a COVID infection in their family. So plenty of work to do, but prioritizing a national health protocol that allows people to be safe and healthy and have all the equipment they need, number one.
Thank you very much, Assemblywoman. Oh, sorry, go ahead, Carly.
Yeah, no, I just wanted to add on that just so that you're aware. It's not just about us everyday people having PPE, but also so many of us with disabilities rely on direct care providers, folks that come into our homes to help with everything from basic cleaning services, personal hygiene, it's a long list. And a lot of them have been having trouble getting PPE as well. And they've been left out of the conversation when it comes to stimulus support and things like that. You know, with everybody in lockdown, a lot of in-person services have been discontinued and people are really hurting for that. So I just hope that you don't just think about the actual individual, but their circle of support as well.
Yeah. Absolutely. That's a great reminder, Carly. And I'm really pleased that, you know, part of the work that I've done in the state assembly side was a partnership with the nonprofit from the Los Angeles Area Business Federation. And our first highest priority was in-home health and support providers, because it was so critically important for the people who do receive those services at home. So very important reminder. Absolutely, that should be part of the whole robust response.
Thank you very much, Assemblywoman. We have a number of other questions, and I just want to get as many of them answered as possible from the Q&A. Rebecca Hindman has a question. Do you have a plan to undo all of Betsy DeVos's actions regarding eliminating and/or weakening Title IX and the funding for students with disabilities within the education system?
Oh my goodness, yes. My highest priority is getting on that education committee to do just that. I have not ever personally, and I used to work at the United States Department of Education, I have never personally seen a Secretary of Education go into the department and do more damage to the fundamental reasons that the department exists to begin with than Betsy DeVos has. So yes, absolutely. Again, look forward to partnering with each of you to hear your personal perspectives, how you've been impacted, and the key areas where not only do we need to restore, but improve upon. Programs that are a very important piece of that work. So yes, absolutely, we need to do it.
Thank you very much. And pursuant to that, and pursuant to much of the conversation where you've discussed the necessity for constituents to partner with you in the future, Mary Platt asks, how will you communicate with us when there is need for us to show up in Washington to testify?
Hi, Mary. Well, we know how to find each other on Facebook, Mary, and you have my phone number, but we will reach out. And again, this is, you know, such an important part of public service work is developing these relationships in the community, so that when you are in a policy area where you need that help and support and where you want to elevate those voices, you have people you can tap on the shoulder and go to. And I am so grateful to have been supported by all of you in that important work. And again, it is the organization and your advocacy that has allowed me to be in this space much more easily. You know, when you provide me information and it is research-based and is statistically accurate and it's timely, and it also directly relates to firsthand experiences and accounts that are happening in real time, that helps me to do my work. So I will reach out to you, but you should never hesitate also to reach out to me.
Thank you very much. I'd just like to ask if I can just fit in just one more question before our time together closes. Kelly Grimes asks, says, thank you very much for your time. I agree that companies need tax incentives to employ individuals who require accommodations. Do you have a plan on how to provide those incentives?
Sure. I think, you know, again, these are conversations that we typically don't have because they're considered niche issues, but we need to start including them in bigger conversations about overall tax policy and in the overall budget conversations. So again, finding for me, and I've been very grateful to have a coalition of colleagues in the state assembly who are very dedicated to the mission and the calling of advocating for the disability rights community. I'll need to find that same group of people in Washington, D.C. who do that work and become a part of what they do. But again, working collectively to make sure that we are putting these issues on the table as a bargaining chip in the bigger conversations, to make sure that these voices are heard, to make sure that these important issues don't get taken off the table and are part of the robust conversation. It's all interconnected, and we need to stop thinking about this as a niche issue or as a one-off.
Thank you very much, Assemblywoman Smith. I would like to turn this over to Steve at this point.
Well, again, I just want to thank actually all 5 of you, members of the community, and you as a candidate for public office, for taking time to discuss our kitchen table issues. Just a parting thought regarding your observation that you found a group of committed legislators when you came to Sacramento. you may not find a group of already committed congressional representatives. We may need you to become that lead voice to help coalesce other people. Would you be willing to take a leadership role in supporting our community? I know you'll be brand new, and it's an enormous undertaking. But would you be willing to be a lead voice for the disability community when you get to Washington?
Absolutely. Absolutely. I'm hopeful that out of 435 people, there would be more than just me, but if I'm the only one, then absolutely.
Well, there is an autism caucus, so you can.
Yeah.
That.
May not be the only one, but they may need some catalyst.
Yeah.
And we look forward to whoever wins this race to being a strong voice for the disability community. And we just can't thank you enough for taking your time to meet with us so close to the election day.
Oh, it's my pleasure. Thank you so much.
Thank you.
Thank you.
Thank you.
Bye.
And so-
Bye, Matthew.
And so this
I
brings to a
see.
conclusion the series of candidate conversations that we've had leading up to the 2020 election. And we know that this is a very important election. But what I want to encourage everyone listening to and watching these videos is to realize that it's really just the start, that the election process is a big piece of the governance and the decision-making process that will affect our lives for every day between elections as well. And we all need to remain alert and vigilant to hold our elected representatives completely accountable for any promises that they may make when they're running for office, and to be sure that we're ready in the next election cycle. We could do this because our disability community in the greater Los Angeles area has been willing to coalesce together and reach out to candidates. But this should happen in every district in the state and every district around the country. We do know that if we're willing to reach out to people running for office, if we let them know that we're 25% or more of the electorate, they need our votes. If they want our votes, they should have to speak to us and earn our votes. And that's how we will eventually assume our rightful position as a meaningful stakeholder in local and national elections. So I want to thank this group and all of the groups that have helped make these candidate conversations a great part of the election process. And I encourage us to stay vigilant. Thank you.
Thank you.
Bye.
Bye-bye.
Bye, everyone.
Goodbye.